Hello and welcome to the 2022 Tyler Prize for Environmental Achievement, considered the Nobel Prize for the Environment, and to this conversation on planetary health. We're joined here in New York by the Tyler Prize Executive Committee and by our 2022 laureate, Sir Andy Haines, in London. Now, if you have any questions that we can ask Sir Andy, please add them here in YouTube in the comments section or by tagging us on Twitter at Tyler Prize. Now, before we get into the Q&A, we're going to start with a short lecture from Sir Andy himself.
Thank you so much for the award of the Tyler Prize. It really is an enormous privilege. I thought what I would do is to provide an overview of how climate change in particular is impacting on human health and will indeed increasingly do so in the future, but also focus on the need for action for health. But before I get into climate change, I want to say a few words about the overarching concept of planetary health. Planetary health is the concept which links human health with the changes in the natural environment. And put very, very simply, planetary health is the health of human civilization and the state of the natural systems on which the health of civilization ultimately depends. So what we do know is that human activities are disrupting natural systems. And this concept of planetary boundaries that was advanced by Johan Rockström, Will Stephan and colleagues some years ago tells us that we live within these planetary boundaries on a small planet, that these planetary boundaries, there are 9 of them, including climate change, but also biodiversity loss, land use change, freshwater depletion, aerosol loading, air pollution, and a range of other planetary boundaries. And as we transgress those boundaries, we will increasingly undermine the very real progress that we have seen over recent decades and in human health. This progress has come at a great cost, not just in terms of inequities, because some parts of the world have benefited and others haven't, but also because many of the ways in which we've advanced human progress have involved unsustainable economic activities, particularly the burning of fossil fuels. So increasingly then, we need to act, and we need to act quickly. And we need to be aware that these various pathways are undermining health in a range of ways. One example would be undernutrition. So undernutrition is being propagated through a range of different pathways. Not just climate change, which is affecting crop yields and crop nutritional quality, but also loss of biodiversity, for example, loss of pollinators. I mean, the food system is already dysfunctional because we know hundreds of millions of people suffer from undernutrition now, and over 2 billion people are either overweight or obese. And this all ends up as impacting on human health. So having given you that broad overview and setting the wider context, let me focus now on climate change and health. And this slide just tries to summarize some of the interrelationships between the emissions of greenhouse gases, which are responsible for climate change, and a number of other climate-related pollutants. So these are causing increasing temperature, up to now about 1.2 degrees global average increase in temperature. And these in turn, through a range of pathways, are impacting on human health. The obvious one is the direct effects of heat, for example, increasing death rates, particularly amongst the elderly, difficulty in working as temperatures go up, also increasing wildfires, and the smoke that we breathe in from wildfires we know is particularly damaging to human health, effects on a range of different infectious diseases, and then the effects that are mediated through social and economic systems, which are more difficult to quantify because they're very indirect, increasing poverty, for example, migration, displacement of populations, and perhaps increased conflict as well. So you can see that physical and mental health are affected in a wide range of ways through the impacts of climate change. This slide looks at data from over 730 sites in 43 countries around the world and documents how climate change is already responsible for more than a third of the total heat-related deaths from 1990 to 2018. You can see the difference between the temperature if we had not been emitting greenhouse gases, which is the lighter line at the bottom, and the temperature which is actually occurring, which shows you how that's going up steeply, and it's now about 1.2 degrees global average. The next slide shows us that as you increase the temperature, it becomes increasingly difficult to work. And that's because it exceeds the human physiological limits of tolerance to extreme heat stress. And the yellow area on the maps shows you that as you increase the temperature with climate change, then the area in which it becomes increasingly difficult to work expands, particularly in sub-Saharan Africa, in Latin America, and much of Asia as well. And when we reach over 2.5 degrees of global average heating, which could occur later this century in the absence of decisive action, then about 1 billion people are exposed to such extreme heat that they're unable to work safely in the hottest month of the year, even in the shade. We also know that some groups are particularly vulnerable, for example, pregnant women. By monitoring the level of extreme heat exposure to which these pregnant women are exposed, they've shown that some of them are already working at such extreme levels of heat exposure that if they were Olympic athletes, for example, they'd be told that they couldn't compete, that they would need to rest, that they couldn't actually physically exercise to that degree because of the extreme heat exposure. And yet these are pregnant women, sometimes in the advanced stages of pregnancy, who are forced to work because they have to provide for their families. So we're documenting the impacts of extreme heat stress on maternal and fetal health. But we also know that climate change has an impact on a range of other diseases. And this is some work we did some years ago, looking at the El Niño, which is a natural climate phenomenon. It occurs every 2 to 7 years. It involves heating of the ocean off the coast of Latin America, and it becomes a global phenomenon. We showed that it affects malaria, for example, in Colombia, Venezuela, Guyana, Suriname in South America, dengue in the South Pacific and other locations, cholera in Bangladesh, forest fires in Indonesia and Brazil, and on a global scale it affects the number of people exposed to drought. And drought, of course, has a range of implications for human health, and this is likely to get worse, of course, in decades to come. And then I mentioned briefly the impacts of climate change on mental health, not just climate anxiety that many young people are experiencing right now because of the uncertain and potentially hazardous future, but also the impacts of climate change through wildfires, droughts and floods. So what do we need to do? Well, we need to take 2 broad types of action. One is we need to adapt to climate change because we can't prevent all the climate change, but we also need to cut emissions because if we don't cut emissions, it will become increasingly difficult, indeed impossible, to adapt to climate change. And mitigation means reducing our dependence on fossil fuels, moving towards clean renewable energy, more sustainable transport systems, and more sustainable food systems as well. So let me give you a few examples, and I'm going to focus on mitigation, on cutting emissions and the benefits of cutting emissions. The benefits of cutting emissions are not just reducing the risks of dangerous climate change, but also the near-term benefits of moving towards a more sustainable economy. And one example is the reductions in air pollution-related deaths if we stop burning fossil fuels. When we burn fossil fuels, we create carbon dioxide, but we also create air pollution, notably fine particulate matter, which gets deep into our lungs and causes a range of health effects. And the map shows you where the air pollution from fossil fuels is experienced. So there's a lot of benefits that we can have by reducing, phasing out fossil fuels, both in terms of climate change and health in the near term. But also moving towards more sustainable diets, and even fairly modest changes like adhering to WHO dietary recommendations would result in a substantial reduction in greenhouse gas emissions, somewhat over 10%. Also reductions in land use, of course driving biodiversity loss, and water use as well. And moving towards a vegetarian diet reduces the greenhouse gas emissions even more, and the land use requirements even more as well. If we could move towards WHO nutritional guidelines in the UK in the population, and this would be accompanied by an increase in life expectancy of about 8 months, something of that order, largely from reduction in heart disease. So that's a diet which involves consuming more fruit and vegetables, nuts and seeds, and less consumption of red meat. But there's a great deal of work that also needs to be done in cities, because cities are where population growth is occurring in the most pronounced way, particularly in Asia and Africa. There's a great deal that can be done through urban leadership for health and sustainability, efficient and accessible public transport systems, for example, universal access for clean, low-carbon energy, particularly in low-income populations that are often burning solid fuels, causing a lot of household air pollution, safe access to green spaces, various ecosystem strategies, protecting watersheds and so on for resilience, but also housing improvements, more energy efficient housing, less polluting energy, and more resilient water supply to houses as well. This is some work we've done on the health benefits of increased active travel. We've demonstrated big benefits to human health, not just through reduced air pollution, but importantly, through increased physical activity. And the slide shows how there would be major benefits to the National Health Service in England and Wales if we were able to get the population of our country walking and cycling like the population of Copenhagen. And those benefits would accrue from reduced diabetes, heart disease, stroke, and other conditions, and amount to something like, in dollar terms, about $25 billion over a 20-year period. And then finally, nature-based solutions. There's a growing interest now in the whole role of nature-based solutions that can help us to adapt to climate change, but also lock in carbon by fostering the growth of trees, protecting wetlands, and so on. If well designed, they can, for example, help to cool cities through green space. They can help to lock in carbon. They can help to reduce air pollution. They can help to provide livelihoods, for example, through agroforestry. But they have to be implemented in a way which is equitable, which recognises the rights of indigenous communities that are often the custodians of many of these natural spaces. So let me then conclude by saying a few words about what we're doing at the moment. And one of my key focal points at the moment is on this initiative called the Pathfinder Initiative. So the Pathfinder Initiative aims to build links with a range of key partner institutions, many eminent colleagues from around the world. So we're reviewing the whole of the world literature on climate change mitigation and human health, capturing the benefits, and we're also capturing case studies of implemented solutions around the world where individuals, entities, institutions in different countries have implemented policies to take us towards a net zero economy. And finally, we're drawing together the evidence we have about what kind of economic and regulatory instruments can help to drive us towards a net zero economy. How can we, for example, develop carbon pricing which also benefits human health and improves equity and doesn't disadvantage the poor? And we will be publishing our report in coming months in the Lancet Medical Journal. And we'll be aiming to make all this knowledge freely available to the scientific and the policy communities as we move forward. So in conclusion then, what I've tried to do is to illustrate the burgeoning impacts of climate change on human health and how humanity needs to react very quickly, because we don't have long. We only have a decade or two in order to rapidly reduce greenhouse gas emissions. Unfortunately, I believe that the 1.5 degree target is receding very rapidly from our grasp, but we can still keep well below 2 degrees if we implement many of the actions that are shown in this slide, and making clear, making public the health benefits of these actions will, we believe, help to motivate much greater appetite and ambition for rapid reductions in greenhouse gas emissions, which will help to set humanity on a much safer course than it isn't at present. Thank you very much.
Well, that's definitely given us a lot to think about. So to kick off the Q&A with the first question, I'll hand over to Julia MARTON-LEFÈVRE, Chair of the Tyler Prize Executive Committee. Take it away, Julia.
So my question is, what advice would you give to promote interdisciplinary thinking among young students?
I think the problem is not so much with their younger colleagues. I think it's probably with us, established academics or policymakers, because we've been brought up in silos. I do think we need to cultivate the generalists alongside the specialists. One of the problems we have is that most of our research funding is also constructed in silos. And then in this new era of the Anthropocene, we need a different way of doing research. We need to actually start off with the big problems and then try to work out how to address them. And that often means bringing a lot of new disciplines that we're not familiar with around the table. So now I work with everyone from earth system scientists to economists, to various social scientists, as well as obviously the traditional public health disciplines. Discipline hopping is really helpful. So I think we should support people who want to switch disciplines.
Russia plays a very important role for the targets of Paris Agreement. What do you think will be the impact of this Ukrainian conflict to achieve and to make progress in the international cooperation, and especially to the multilateral environmental agreements?
I really worry about the isolation of Russia because it controls so many environmental assets, enormous biodiversity, as well as, of course, vast fossil fuel reserves. So having them excluded from the global system is, of course, extremely dangerous. Whilst I understand and share much of the revulsion to the violence in Ukraine, I think it's important to recognize that this military confrontation is not engineered by the Russian people. It comes from the Russian government. We need to try to keep open those channels of communications as far as it's possible. The situation does offer some opportunities. The fact that Russia is going to be increasingly excluded from providing fossil fuels to much of Europe strengthens the argument for more renewable energy. But I hope they'll also use the opportunity to rapidly scale up their investment in renewable energy and, importantly, energy efficiency.
I wanted to ask you whether you could give an example of how your work has led to policy change, either by governments or by international organisations.
Climate change and health has become increasingly prominent in international discourse. The work of the World Health Organization on climate change and health has really expanded since our Lancet report in 2009. And so I think we have had a tangible impact on the work of WHO. In Wales, for example, the work we did on the health benefits of active travel helped to influence the Active Travel Act in Wales, which supports local governments to increase opportunities for walking and cycling. A few years ago, 2019, the UK Parliament, the Environmental Audit Committee, published a report on planetary health, which I don't think they would have done in the absence of the Rockefeller Lancet Commission on Planetary Health, which published in 2015. So some of those concepts are beginning to enter the mainstream. Through the Pathfinder Initiative, we're working with partners, including OECD, the UN Sustainable Development Solutions Network, the C40 cities, CDP, and the Alliance for Health Policy and Systems Research to document really the lessons from the implementation of health-enhancing climate change mitigation policies. We're certainly seeing some progress, and climate change and health has a much wider recognition than it did a few years ago.
You've mentioned the role of government and the role of international organisations and learned societies, but where else do you think the agents of change are going to come from?
Social movements obviously vital, and again, working with younger colleagues, including younger people at school, is really important. I do see that academia has a really important role in working with NGOs, with more activist and advocacy communities, giving them the evidence that they can use to put pressure on governments, but also to change opinions, values, and actions at the community level. The citizens' assemblies, I think, are another very interesting way of moving forward. I do think working with some of these innovative approaches to change public opinion and to create better conduits between government and the public is an important role for science.
What's the most common reason why governments or policymakers might resist some of your messages and try and slow it down or resist change?
Yes. Well, of course, this happens all the time. I mean, obviously, one argument is the cost of change. It's all too expensive. A lot of that's based on the fact that we're not actually costing in the full economic cost of the fossil fuel economy and unsustainable food systems. Well, if you value some of the health co-benefits that come from decarbonisation, these could help to offset the cost of making the necessary changes. Of course, there are difficulties of changing behaviour, but in the end, of course, you have to try to bring the majority of the public with you and to articulate very clearly why it's necessary to make those changes, why it's inevitable, and why the sooner we make those changes, the less costly and disruptive it will be. A lot of the kind of climate disinformation, of course, is funded by vested interests. Actual climate change denial, I would say, has decreased to some extent. But what we're seeing now is more a kind of nuanced approach, which says, okay, climate change is here, but it's not that bad and it's costly to do anything. We do need to combat those vested interests, I think, by pointing out the weaknesses in their arguments and to try to combat the kind of political inertia which these vested interests can sometimes engender.
So, Sir Andy, what are the greatest lessons that have emerged from the COVID pandemic for achieving sustainability and equity around the globe?
COVID showed us that international scientific collaboration is vital to address these global health challenges. But this potential for collaboration often falls short of what's really needed. For example, in the delayed vaccine rollout and the inequities in vaccine coverage, have profound echoes with the current climate injustice. There will, of course, be no vaccine for climate change, but there are many technologies, policies and actions that can make a real difference, either by helping us to adapt to that climate change that we can't prevent, or to mitigate, to cut greenhouse gas emissions as rapidly as possible. Something we also found with COVID is that systems approaches are needed. If you just have a very narrow focus on health, you can have unintended adverse effects, such as, for example, worsening income inequalities. One of the other lessons we found from COVID was that countries that appear to have robust health systems on paper didn't always perform as well as others that on paper appeared much weaker. Some of these deficiencies could apply to climate change. So, for example, high-income countries can't assume that they won't be affected severely by climate change. We also saw that research was often very narrowly focused on technological interventions like vaccines, but the research neglected healthcare and social support systems, as well as evaluating effective public health interventions.
How is it that we can advance equity, climate justice, and adaptation to climate change simultaneously and quickly?
The whole issue of loss and damage as part of the Paris Agreement that Warsaw will be very much centre stage at COP27 in Egypt. Low middle income countries are pushing for adequate financing, perhaps reparations and so on. So there's going to be, I think, quite a lot of tension at COP27 because of these divergent opinions. So until recently, it's been difficult to know whether a particular climate event or a trend was due to human-induced climate change or whether it was due to natural variability. But increasingly, the science is advancing. Climate change science colleagues are increasingly able to, with confidence, say whether a particular event was likely to happen due to climate change or not. This kind of work, linking it to human health impacts, is going to be very powerful, I think, in demonstrating that climate change is having a tangible impact. We need to incorporate some indigenous knowledge into adaptation strategies that we can use to adapt to extreme weather events, for example, or environmental change. In addition, we need to integrate climate change mitigation and adaptation into the Sustainable Development Goals, which are still the overarching framework by which we monitor and measure progress towards sustainable development with limited resources. A difficult consideration is, if we accept that there's a limited number of emissions remaining, how do we actually divide those up in an equitable way? My own view is that high-income country populations that have benefited the most from burning fossil fuels and unsustainable patterns of consumption must make the commitment to reduce their emissions more quickly than those low-income populations who often contributed so little to the problem.
How do you think the increase in severe drought will impact the transmission by mosquito vectors of dengue and malaria?
It's a very interesting relationship between drought on the one hand and floods on the other, and how they can affect different vector-borne diseases. With drought, dengue transmission can increase because the vector mosquitoes can breed in water storage containers, which are often used to store water in urban environments. In designing adaptation strategies for drought, we really need to bear in mind that badly designed adaptation strategies can also have negative effects on health through, for example, increases in vector-borne disease transmission.
In your talk, you mentioned nature-based solutions to address climate change. And many nature-based solutions have been implemented by indigenous peoples to protect natural habitats and manage forests. So how can we apply nature-based solutions on a broader scale to promote sustainability and equity?
We're beginning to realize that nature-based solutions can play an important role. Some assessments suggest they could provide up to 30% or more of mitigation actions. But importantly, nature-based solutions provide an opportunity for both adaptation and mitigation. Now, there are different types of nature-based solutions. There are those that really rely on the protection of existing biodiverse locations, those that rely on the restoration of degraded land. And then there are types which are essentially novel ecosystems. Indigenous communities are natural custodians of much of the world's biodiversity. And very sadly, in many parts of the world, they're being harassed, they're being displaced from their land, they're even being murdered in some cases. There is a real need to make common cause with the Indigenous community and to listen to some of the knowledge that they have about how to protect the local environment. There are many potential health benefits from nature-based solutions. So, for example, access to green space in cities is good for mental and physical health. It also helps to reduce the urban heat island because it cools cities, and therefore means that we need to use less energy in air conditioning.
There seems to be a complex and indeed perverse connection between the growth of the meat industry, the degradation of natural ecosystems, and human health. So what do you see as the realistic next steps to achieve a sustainable, healthy diet for the world's population?
We're seeing decreases in meat consumption in some populations and increases in plant-based food, particularly, for example, amongst the young. We need to accelerate those changes. And one of the key constraints is affordability. And we do know that eating a healthy, diverse, predominantly plant-based diet is expensive in many parts of the world. Approaches to improving affordability, reducing waste are going to be absolutely crucial if we're going to scale up affordable and sustainable diets. Novel foods, insect protein, for example, are becoming increasingly available, potentially do have a role in reducing the environmental footprint of the food system and providing nutritious food. Whether they're acceptable, of course, to people is another question, but acceptability can be changeable. And the meat industry, like any other major industry, can be a major barrier to change, but major changes are occurring in people's dietary choices. And of course, other commercial concerns are basing their business model on promoting a sustainable, healthy, more plant-based diet. So they are counteracting some of the influence of the meat industry.
Why do some things actually work? How do we find them? How do we look for them? How do we make them grow?
This is really the work we're trying to do in the Pathfinder Initiative. What we're trying to do there is not just to model the potential benefits of climate action, but also to capture the lessons from implemented projects. We have found a number of case studies where this have been very well documented. For example, the renewable energy portfolio standards in the US. There's good evidence that they have reduced air pollution related deaths significantly to the tune of several thousand premature deaths averted over some years. We also know, for example, that some countries have been successful in removing fossil fuel subsidies. So there are some examples. We need to cherish them. We need to document them. We need more examples. But there are examples of actions that have had a really tangible, desired, beneficial effects. There's a big challenge, I think, in accelerating people's ambition and improving metrics. You know, you actually need to measure change. You can't just guess. You need to measure changes in emissions and changes in health. And that's a big challenge, which many people have ignored. It sounds very boring and very prosaic, but actually it's really important because it'll help us to distinguish between real action and greenwash, and also to see whether we're having any unintended adverse consequences, as well as the benefits that we hope to see.
Well, that was a very robust Q&A, but unfortunately that's all the time we have today. Thank you so much to our laureate, Sir Andy Haines, for those fantastic answers, and to our Executive Committee for the Tyler Prize for those fantastic questions. If you'd like to learn more about planetary health, please go to planetary-health.co. And if you'd like to learn more about the Tyler Prize, or perhaps nominate a future laureate, go to the website tylerprize.org. Thank you so much.